On this podcast today, it's going to be a bit different than what we normally have. I am going to spend some time today telling you about some pretty crazy stories that I've heard throughout being plastic surgeon for 20 years. These are stories that will shock you and hopefully maybe we can learn a few things along the way. Okay, so today's podcast is going to be just you and I am going to tell you some pretty fascinating and somewhat disturbing stories in plastic surgery. And I'm going to change details so that you cannot obviously identify the patients. None of these are my patients. None of these, well, one of them I was there when it happened, but the other ones I was not. So some of this is what I hear through the grapevine from hospital staff and people talking. But to my knowledge, all of these stories are true. And like I said, they're fascinating and we can learn a lot from them. So the first story I'd like to tell you is an interesting story about a patient. And this was a patient that I'd heard about, a patient out in California, actually, who had brachioplasty surgery. Brachioplasty is an operation where you remove excess skin from the arms. Often it's combined with liposuction. And so in people who have, let's say, lost a lot of weight, or some people it's just the aging process, they develop loose skin of their arms and sometimes fat deposits that they want to get rid of. When you're dealing with the arms, there are really only two operations that you can do, common operations. You can do liposuction if it's purely just a fat issue and it doesn't have to do with excess skin, or you can perform a brachioplasty where the excess skin is removed and usually fat is liposuctioned and sometimes cut out with it. Now, during a brachioplasty surgery, you remove the excess skin and then basically stitch it together. And some doctors will put a little bit of it, we'll put like a small drain in. Other doctors may not. Well, this surgeon was a relatively newer surgeon who thought that she was basically the be-all, end-all and performed a brachioplasty surgery on a patient. And one of the things that you always do in plastic surgery is when you cut off skin, you have to make sure that there is enough skin left over that you can close your incisions. Okay, so for example, whenever I do a breast lift, I actually will mark the breast for removal of skin, or let's say a tummy tuck, and I will pull things together before I actually make the cuts to make sure it will close up. Because worst case scenario, you don't have enough skin left over, and then what do? That's a major, major problem. And so this doctor out in California, a female doctor, performed a brachioplasty on this patient. And instead of very carefully measuring out and removing the skin, just decided to slice up and dice up and remove that skin and then try to stitch it closed afterwards. But unfortunately, this doctor removed too much skin. And when she tried to close the incisions, she couldn't pull it together. So that's a big issue. And I learned about this from somebody that was in the operating room telling me this just terrible story. So now we're in the middle of the operating room and the doctor finds that she removed too much skin, but like unfortunately some surgeons will not admit that she made a mistake. So what does she do? She takes huge sutures, big, thick sutures, and tries to basically yank the arm shut. Well, whenever you do that, there's going to be tension, okay? And what happens after you have surgery? You swell up. So this doctor, she basically takes large sutures, starts whip stitching the arm shut, pulling as hard as she can essentially to try to bring the skin together, and actually gets it closed up on both sides. Puts the dressings on and then sends the patient to the recovery room. Well, the nurses in the recovery room, I tell you, usually are very, very sharp. Nurses are some of the absolute most integral people in the hospital because they know their stuff. And these nurses took a look at this patient, and the doctor then took off, went home, and started seeing that the patient's hands started turning blue and purple. The nurse looked at the arms. The arms were super, super tight, where obviously the arm was whip stitched shut, and tried calling the surgeon to say, there's something wrong here. The patient's hands are starting to swell up. I think that there's a circulation problem. So when you have too much tightness around an extremity, what is that? Well, basically it's like a tourniquet. And when you have a tourniquet, you know how it feels. If you ever get your blood pressure taken and that cuff gets really tight, you know how that feels. And imagine if that's a permanent state. Well, what can happen essentially is that your blood pressure in your arteries is much higher than the blood pressure in your veins. And so when your heart pumps blood out towards, let's say, your hand through the arteries, it takes a lot to cut that blood flow off. But once that blood then goes through the arteries and it supplies oxygen to your tissues, then veins bring that blood back to your heart essentially, so that that blood can then go to your lungs, get oxygenated, and then pump back through the arteries to other parts of your body to oxygenate them. That's kind of how the circulatory system works. But when you have essentially a tourniquet on your arm, what happens is that you cut off that blood flow coming back first. The veins shut down first because the veins don't have quite that blood pressure in them. They don't have that heart pushing that blood back. And so veins will shut down first. And what happens is you get this buildup of venous congestion, where the blood itself has supplied oxygen to the tissues. It goes from being bright red to kind of purplish, and it comes back to the heart and the lungs actually to get oxygenated again. But that blood starts building up because those veins start being unable to actually pass through that tourniquet part of the arm. And that's what was happening to this patient, is her hands were turning blue, they were getting puffy because that blood, even though the artery was pushing the blood to the hands, the veins were unable to bring them back. So the hands start swelling, and then the nurse calls the surgeon and says, there's something horribly wrong here. You need to come and see your patient. So what does the surgeon do? Well, a good surgeon would say, I will be there right away. And you come into the recovery area and you see what's going on and you take care of your patient. Like, that's what you do. But if you are a doctor who thinks that you don't make mistakes, then you don't come back in and you tell them it's fine and that you will see it tomorrow, which is exactly what this doctor did. Well, by the time the doctor saw the patient the next day, the patient was in full-fledged compartment syndrome. Compartment syndrome is when you have so much pressure on your extremity in those hands and the arms that in addition to that blood basically just being pooled and trapped there, you start getting pressure on the muscles and other important structures, that the pressure builds up so much that you start getting actual tissue death, meaning that the pressure is so high, your muscles can die, your nerves can die, and it can eventually lead to amputation of those limbs. So in that situation, what should a surgeon do when you notice that a patient has compartment syndrome? Well, the first thing, if you're not sure, you can get compartment pressures. So there are actual probes that you can stick through the skin to figure out what is the pressure inside of this limb. And if it's above a certain amount, you know that that pressure is too high and you have to release it. Well, how do you release it? You basically cut through the skin and the fascia and the other tissues to release everything and open it up. Well, she had all of these sutures that she could have just removed to open everything up and release that pressure. And she would have done that had she admitted that she made a mistake. And so in that situation, if that was my patient in general, and if you're a responsible plastic surgeon, you would know that the treatment is that you remove all the sutures. You have an open wound there now that you cannot close because, once again, too much skin was removed. But what she could have done was taken a skin graft of the skin that she took off before and use that as a skin graft to cover any open areas. And that in and of itself would have preserved this patient's function. But because she was too arrogant to admit that she made a mistake, she did not do that. And this patient ended up suffering major issues afterwards. And one of the worst parts of all of this is when the patient asked the doctor, why did this happen to me? Instead of the doctor saying, honestly, that, you know what, you had swelling there after too much skin was removed. Essentially, I'm sorry, I made a mistake. The surgeon blamed it on anesthesia and told the patient that it was anesthesia's fault that this happened to her, that anesthesia must have given the patient too much fluid or something like that, but tried to actually throw anesthesia under the bus, which we joke about that in surgery, that when something goes wrong, patient starts bleeding, we blame it on anesthesia. Oh, their blood pressure is too high. But it's all, in general, that's not serious. And when you get into a situation like this, to actually make a mistake like that and then to try to blame it on other people is just a sign that you should lose your license. I mean, really, you should. So this was kind of a crazy story. This is not my patient, thank God. And I hope that patient ended up doing well. Once again, this is what I've heard through the grapevine. I do believe this story is true. Certain things obviously have been changed to protect privacy. Okay, the next story was actually one that I put in my book, Playing God. This is a book that I wrote several years ago. It is a memoir about what it's like to go from graduating medical school to becoming an actual successful plastic surgeon. Really proud of this book. It was the third book that I've written, and it's available wherever books are sold. It's called Playing God: The Evolution of a Modern Surgeon. And one of the stories that I gave in it was a story from when I was out in Beverly Hills, and it was a really disturbing story. You know, there was a doctor that I would occasionally work with when I was out in Beverly Hills, one that would basically rent OR space from the doctor that I normally worked with. And I would assist this doctor occasionally when the doctor needed some help. And sometimes what we would do is we would do liposuction together. It's much faster if you have two surgeons doing it versus one. And I was a board eligible plastic surgeon, meaning that I completed all my training. I was just doing additional training in cosmetics. And so we had a patient that came in. She was an African-American female. And she was a larger woman, and she signed up for liposuction of multiple parts of her body. And so with liposuction, the FDA recommends that you limit it to about 5 liters. Okay, so you can remove up to 5 liters of liposuction in one surgical setting. Anything more than that, more than 5 liters, the FDA does recommend that you either do it in a hospital setting and or you have access to blood products, basically transfusions. Because once you get, the more that you remove fat-wise, the more blood loss there is, and the greater chance you may have that patient may need a transfusion if they've lost too much blood. So we're in a situation, we have a larger woman, and honestly, she could have done fine with the entire 5 liters of liposuction. She signed up for the surgery. She was a larger woman. 5 liters, which is probably just over 11, 12 pounds, could have definitely been taken from her and hopefully given her a nice change of what she was looking for. So we're doing this operation, we're sucking out fat, and we're probably about 3 liters in. We're in the surgery maybe an hour and a half, 2 hours, and then he says, all right, we're done. And so I looked down at the patient, I said, well, we're only at 3 liters, we can definitely do more. She's very stable, we didn't lose that much blood. And he said, no, you know what? I gave her a special and she has HIV. So you know what? Let's just stop it. She should be, she should be happy anyway. I mean, we don't need to do more. She has HIV and I gave her a special deal. And I was flabbergasted because what does, number one, getting a discount and number 2, having HIV have to do with getting her a reasonable result from this operation? I mean, obviously nothing. But to this surgeon, he felt that he did not have to give her an optimal result, did not owe that to her because she got a discount and she has HIV. And I wonder how much of it too is that she was an African-American female. Does that have anything to play into it too? And so, it was one of those things where I realized, working out in Beverly Hills, how much, and I spent an entire year there. And I tell you, there are some great plastic surgeons out there, but there are doctors too where, really it just comes down to money. That it's money and it's also, after reality shows and social media, it's so much of it's about fame. And it's not necessarily about taking the best care of your patients. And that's one of the things that really struck me. And honestly, one of the reasons why I didn't end up practicing in Beverly Hills was because I knew what it was like down there. And like I said, I love the doctors I worked with and stuff like that. But in the end, it was all kind of bottom line. It was about the money. And it just wasn't my thing. And so, yeah, that was just one of the stories from Playing God that I put in there. There's a lot of better, more interesting stories too. But just one that I wanted to bring up is today kind of the topic, I think, of this podcast are just these kind of crazy stories that you hear about or that you experience as a plastic surgeon over 20 years that you can't believe that certain doctors would actually do this type of thing. It is a bit of a buyer beware, I guess, this episode, but interesting stuff. Okay, this one is it's in some ways you can almost make it think it's humorous if it wasn't so horrible for the patient. So in an area not too far away, there was an ER doctor who fashioned himself as being one of the top cosmetic doctors in the area. And this ER doctor brought on a partner who was an eye doctor. So now you have a plastic surgery practice, a cosmetic surgery practice with both an ER doctor and an eye doctor. And according to what I hear from stories, and I don't know how much of this is true, but this is what I hear, there was a patient who had breast augmentation. And when you do breast augmentation, you can put implants through one of 4 different ways. Most of the time, the vast majority of the time, I put the implants through a small incision underneath the breast. Studies show that it has the quickest recovery and the lowest risk of complications. And once these studies came out, I stopped doing it some of the other ways because the number one thing is you want to make sure your patient doesn't get a complication, okay? So you can put the implants in through a scar, an incision under the breast. You can also put them through a scar or incision around the areola. That's the colored circle around the nipple. That study showed does appear to have a higher risk of capsular contracture or excess scar tissue versus putting it in through underneath the breast. You can also put it in through the armpit, and typically saline implants are the ones that are usually put in through the armpit. And then you can even put them in through the belly button. The belly button is quite controversial. Obviously, there's minimal scar there, but in order to put it into the breast, you are unable to do certain things like divide muscles and stuff like that may be needed for the implant to settle appropriately. So when you put an implant into the breast, you can put the implant either above the muscle or underneath the muscle. And the muscle that we're talking about is a pectoralis major muscle. The pectoralis major muscle attaches from the humerus, which is the bone at the top of your arm, and it goes from the humerus to the sternum and to the chest. And it attaches in different ways in everybody. But in some people, that muscle attaches kind of off to the side, giving a bit of a space between the breasts. And in some patients, those muscles have a lot of connections to the underlying ribs as well. And that's one reason why I like to do the surgery the way I do, where I make an incision underneath the breast and I can actually create the pocket all by me being able to see it under direct vision and under a lot of... Well, these doctors did a technique which I used to do way back in the day, but I stopped doing it, maybe 17, 18 years ago, where you make an incision in the armpit and then essentially you tear open a pocket underneath that muscle and you stuff the implant through the armpit into that breast pocket. The problem with that technique is that it's really hard to divide the muscles appropriately if you're going under the muscle to make sure that it is sitting in the right spot and that it settles naturally. So unfortunately with this patient, the eye doctor performed this breast augmentation through the armpit and put it into her breasts, but got them stuck. And he got them stuck in the armpits. He ended up finishing the operation with her implants basically in her armpits and sent her home. The patient came back for her post-operative appointment and understandably was not happy because you don't go in to get breast implants and come out with them in your armpits and are happy about that. So she ended up going to see her eye doctor, who I'm sure she didn't know was an eye doctor, thought was a real plastic surgeon, not an eye doctor. And the eye doctor, of course, looked at it, well, geez, I don't know what to do. This isn't like, you're not getting a treatment for your cornea. You're not getting a glaucoma treatment like this. I don't know. What do I do with this? It's in the armpit. So, of course, the eye doctor said, look, let me call the expert. And who did the eye doctor call in? The ER doctor. And the ER doctor comes in as the quote unquote expert and, kind of shaking his head. I don't know how to, I've never seen this before. Well, of course you haven't seen it before. You're not a plastic surgeon. So this poor patient ended up going to a real plastic surgeon to get fixed up. And the moral of this story is that plastic surgery is a wild west of medicine. There are so many doctors out there who are performing plastic surgery, and they tell you that they're board certified. But the big question is what are they board certified in? Are they board certified in emergency medicine? Are they board certified in family medicine, in cardiology? You got to find out and make sure that if you're going to have plastic surgery, that your plastic surgeon is actually certified by the American Board of Plastic Surgery, not by some other board. Okay, and that's how they try to trick you. They'll say, hey, I'm board certified. Well, you could be board certified in pediatrics, and you can moonlight as a cosmetic surgeon, believe it or not, and there's no law against doing that. And that's what doctors are doing. And the way that they get around it is that they open up their own operating centers in their offices. They hire a nurse to do anesthesia for them, and they just start putting implants in people on the weekends and stuff like that. So buyer beware. Make sure that if you have plastic surgery, it's a real board-certified plastic surgeon. If you're getting breast implant surgery, make sure it's a real plastic surgeon, because otherwise your implant may end up in your armpit. So there you go. This last story was one that was just kind of a bizarre story that I heard about. And this was a doctor out in New York that I heard about. And I heard this from a very reliable source. Basically, a patient told this doctor that this is what happened. So this was during COVID time. So if you remember, March of 2020, most states, I think all the states in the union, closed down for only essential treatments for a certain period of time. And as plastic surgeons, I closed my office down in early March of 2020, and it was closed for 2.5 months. During that time, I saw patients with telemedicine, but really what did I do? I was making TikToks and YouTube videos because, we couldn't see patients. But that doesn't mean that there weren't people who were breaking the rules. Now, at the time, New York was getting hit really, really hard by COVID. And there were obviously people who were dying. The hospitals were getting filled up. I mean, they got hit really hard. Plastic surgeons stopped operating. And a lot of them, I know certain ones there where they ended up volunteering in the hospitals to try to help out. A lot of them donated their actual anesthesia equipment to the hospitals because they were using anesthesia machines as ventilators. And here, even in Michigan, they asked for plastic surgeons who have their own private ORs if those ventilators could be sent to the hospitals to help save lives. So all of this is going on, and you would think that, especially if you're in a hot spot like that as a surgeon, that a plastic surgeon, that you would say, okay, you know what, let things cool a bit, and let me not stress the medical system, because man, it was a crazy time at that time. But I heard about this one doctor who decided not to do that and ended up performing operations in his office in New York, cosmetic surgeries. And at one point, they were doing these operations after hours because they didn't want people to know that they were doing it, because it was technically against the law at the time, because it was only essential services. So this doctor, this plastic surgeon, would actually have his patients come in the evenings when the people weren't around, when security was gone, everything like that. The patients would come, and then he would operate on them to try to make money. And he would charge a lot of money for it, because now during quarantine, people were sitting on money at the time. And so he would charge really high prices. Then you would go into his office and he would do these operations on you, and nobody be any the wiser. Well, unfortunately, he had a patient that he did a brow lift on, started doing the operation at about, I heard like around 9, 10 o'clock, something like that, and was doing a brow lift in his office under a local anesthetic, because he couldn't bring in anesthesiologists or nurse anesthetists because they were in the hospitals helping out. They weren't going to go and go to some cosmetic doctor's office and do a brow lift. So he does this under a local anesthetic, and the patient starts to bleed. And he can't stop the bleeding. The bleeding just won't stop bleeding. And if you've ever had a cut in your scalp, that bleeds like stink. It really, the scalp is so vascular, it bleeds a lot. So here he is, this patient's bleeding in his operating, I don't even think it was really an operating room. It was like a procedure room in his office. He's trying to make extra money against the law. This patient's bleeding, and he cannot bring the patient to the ER, because then he would get found out that he was performing basically illegal operations for the money. So what does he do? He puts pressure on this woman's forehead for hours and hours. And at 2 or 3 in the morning, he drives her home in his own car. And just craziness. And unfortunately, this is a real board certified plastic surgeon that did this. And luckily the patient ended up doing okay, ended up not, bleeding out and hemorrhaging and dying. But just another one of those things that unfortunately, it irks me, because I hear these stories all the time from colleagues, from nurses. Even in my area, in the Detroit area, you hear these types of stories a lot. And it just shows how there are unfortunately a lot of cosmetic doctors out there, and some of them are real plastic surgeons who only care about the bottom line. And so it's just unfortunate. So just some kind of crazy stories I thought that I would share with you on this podcast. I promise you that I will have a podcast where I share really good, funny, happy stories as well. But really, buyer beware. If you're considering cosmetic procedures, get multiple opinions. Make sure you really vet your doctor well, vet the procedure well. I tell you, you never regret plastic surgery that you don't do. You only regret the work that you did that you shouldn't have had done in the first place. So remember that next time you consider surgery, and only do those operations that you feel you absolutely need to have done, and make sure you really, really vet that doctor well, okay? So that was the podcast for today. If you enjoyed this podcast, if you could leave a rating or review on iTunes or Spotify or wherever you get your podcasts, once again, it definitely helps me spread the word. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.